which is a new oral medication for relapsed or refractory AML, specifically for patients with the IDH1 mutation. So in addition to all of those new approvals, we're also seeing expansion in indications, both for oral and IV medications. So there's a lot to know, and these approvals are not going to be slowing down anytime soon. So with a growing number of oral medications available, what we're seeing is a significant shift in disease management from our providers to our patients. That means we're relying more on patients' involvement in their own care and treatment. And so in fact, it's really crucial that they take an active role in their care. So how do we continue to engage our patients and arm them with the information and the resources that they need to optimize adherence? Because it's not just the provider's responsibility anymore. So nurses and pharmacists are often partnering in this endeavor. So what is adherence? Well, ASCO and ONS define it as the degree or extent of conformity to the provider's recommendations about day-to-day treatment with respect to timing, dosing, and frequency. And it's dependent on patients' complete understanding of why they should follow their doctor's recommendations about treatment, not just doing what they say. And so why is adherence important? Well, we're really trying to get the best response and prevent unnecessary healthcare costs, which could come from disease progression, as well as toxicity from treatment. But it's really hard to predict which of our patients are going to be really good at this adherence component. And it's really challenging to monitor as well. And when the outcomes are less than desirable and patients experience disease progression, can we really attribute what we are seeing to poor adherence, or is it maybe drug resistance? So some things to think about. What are the barriers to adherence? And it's important to understand these because we want to overcome them as much as we possibly can. And I think there can be limited understanding on the patient's part about their treatment, the side effects associated, as well as the required monitoring while they're on treatment. And some patients just need that re-education and constant reminders about, their medications and what they're supposed to do. Again, that higher level of understanding is really important in terms of needing to follow that treatment plan. But we can also ask, was the education we provided enough for our patients? And was it appropriate? Did we provide the information in a manner that patients could digest? Written and verbal information is really important, not just handing off a stack of materials for them to review. Did we give them a chance to review the information and ask any follow-up questions? Also, many patients have to get these medications filled at a specialty pharmacy. So what kind of education does a specialty pharmacy provide? There can be a lot of differences between these specialty pharmacies. And then again, if they're not getting it filled at a specialty pharmacy, patients may not be getting the comprehensive education needed when the pharmacists may not be seeing those types of medications regularly. So can't really guide patients in terms of the side effects that they should be looking for, when to report things, and that type of, those types of things. Patients might also have some concerns about the associated side effects, and maybe haven't had an honest discussion with their providers about what those concerns might be. They might have difficulty taking the medications orally. Sometimes the regimen or the instructions for those medications can be complex. And I know that that is true for some of the combination multiple myeloma regimens that we have out there. Patients also underreport side effects because they're afraid of dose reductions, holding or discontinuing treatment. They can be anxious or depressed, which could be related to disease or treatment, and even about their own support during treatment. And the last of the barriers, but certainly not the least, is cost. These drugs are very expensive, and patients now worry about that in addition to the stress of being sick and wondering whether their treatment will work. So whatever the barriers you're identifying in your patients that are on oral chemotherapy, it's important to identify them as quickly as possible and work with them to overcome whatever the barriers you're identifying. first and foremost, it's going to be decreased efficacy. And with the cost of these medications, it seems really wasteful to be paying so much for something that isn't working as well as it could be. Drug resistance is something that we need to consider. This may have an impact on next steps for treatment and options available in the future. There's also increased comorbidities, especially if patients have other medical conditions. More toxicities is certainly something to consider as well, and the potential need to use additional medications or other interventions to treat those toxicities will certainly add to the overall cost of care. Again, patients may not be as communicative or open with their healthcare team about what's going on, so that's something that we need to think about. Could also be seeing more visits to the ER or hospitalizations. So again, another avenue for increasing overall healthcare costs for our patients. And there's a term that I've heard quite a bit recently called financial toxicity with regards to chemotherapy in general, so not just the oral chemotherapy agents. And more and more, those added costs are going to be coming out of our patients' pockets. So we do really need to try to work with them to find out what these barriers are to improving adherence on their part. Are there practice standards for oral chemotherapy? I think you all know this and have seen this, but ASCO and ONS collaborated to develop the chemotherapy administration safety standards. It was first released in 2009, and since then we've had about 3 updates. And the standards that were related to oral chemotherapy were first added in 2013, so not too long ago. There are 4 standards that I want to briefly review, just so that we're all familiar with what our practice should look like, what we should be thinking about when we're thinking about oral chemotherapy process and looking at adherence. So the first standard is that patients are provided with verbal and written or electronic